when you're breastfeeding actually stimulates some hormones in a female body. Hormones in a female body, as I mentioned earlier, can be triggers or risk factors for breast cancer. When a female is breastfeeding, there are certain hormones that are increased. Hormones that are specifically estrogens and progesterone. And estrogen has been studied and has been seen as one risk factor. An elevation of estrogen or progesterone can be one risk factor of increasing the risk of breast cancers. So, in connection with breastfeeding, elevation of some hormones, breast cancer should be considered. We have our Department of Health, which has come out with some guidelines on when to go for the checkup for breast cancer. And our medical education has told us to, especially if you are in the specialty of OBGYN, you take care of females. And as I mentioned earlier, yung cancer used to start as early as 40, but nowadays we have been seeing breast cancer at the age of 30. Okay, so what the Department of Health has recommended is if you are at the age of 40, okay, and you have what we call these risk factors that I mentioned earlier, there are several of them. Like, for example, if you have a relative that has breast cancer and you are in the age of 40 and you felt something in your breast, it's a good idea to go for an early screening to check out if it's a cancer or not, okay? So that's like the first examination recommended by the Department of Health, okay? So if your first breast screening exam is normal, okay, then chances are it won't develop anything after another year because breast cancers can be slow. So what we recommend is after the age of 40, if you have other risk factors, you should go for breast examinations for every year. So every year between the ages of 45 and 50. Okay, if you have no risk factors and no symptoms and you don't feel any lumps in your breast, then you can actually postpone this and do it, spread out the examinations a little longer. Breast cancers can occur in males, but it's so rare it's less than 1%. And as I mentioned also earlier, breast cancers are triggered by the conversion of a breast cell, an abnormal breast cell, into a precancerous cell, okay? And this more frequently is triggered by the estrogen progesterone cycle of the female. But there are males that have estrogen unusually, abnormally, okay? So if a male has even a slight production of estrogen and is a cancer-prone patient, as I mentioned earlier, there are genetic data that says a person can be cancer-prone, meaning they have cells that when triggered by, let's say, for example, an estrogen surge, then you can have cancer in a male. So it is possible. Personally, I would say ECARMA would not replace hormone replacement therapy because, first of all, hormone replacement therapy could actually be a necessity, okay? This is a hormone substance that the body requires on a daily basis, okay? Nara Extra, ECARMA, is a protective ingredient, and an inflammatory ingredient, and also an anti-cancer ingredient. So these two substances are complementary to each other. Okay, so you cannot say use ECARMA to replace hormone replacement therapy because there are two different ingredients. If you combine the two, it is a very good combination because the hormone replacement therapy will actually be supported by extra protection and anti-inflammation, which can actually be caused by the hormone replacement, And also, when the hormone replacement, as we say, can induce cancer, ECARMA can actually kill the cancer cells that are resultant because of this estrogen. So these two ingredients are actually complementary.